A stroke can happen at any time to anybody, regardless of age, gender, or race. In less than a minute, your life can change forever. Hi, welcome to this pocket program. I'm Kathy Sciarappa, a member of the stroke team here at Firelands. Firelands is certified as a primary stroke center, which means we have procedures in place to quickly diagnose and treat our stroke patients, thereby improving their health outcomes. A stroke occurs when there is a sudden disruption of blood flow to the brain. Most often this is caused by a blood clot, but can also be caused by a rupture in a blood vessel in the brain. Risk factors for stroke include high blood pressure, diabetes, high cholesterol, and smoking. These risk factors affect your blood vessels and may also contribute to heart disease, peripheral vascular disease, and carotid disease, further compounding your risk for stroke. Atrial fibrillation is another risk factor because of the possibility of developing a clot that travels to your brain. Managing your risk factors is crucial in preventing a stroke. Almost 800,000 Americans experience a new or recurrent stroke each year. Pain is often a big motivator for seeking emergency care. However, with stroke, pain is not always present. I want you to be able to recognize the signs and symptoms of stroke so that you can act. But you need to be fast. And let me explain this acronym. B is for balance. Look for a sudden loss of balance, unsteady gait, uncoordinated movements, leaning to one side, or complaints of sudden dizziness. E is eye. Notice any changes in vision in one or both eyes, or eye deviation. F is face. Look at the face and for an uneven smile or a droopiness. A is arms. Hold the arms straight out and look for any weakness or drifting, unable to hold that outstretched position. S is speech. Listen for any changes in speech, slurring of words, inability to speak clearly, or maybe not be able to speak at all. T is time to call 911 and get to the hospital immediately. Time equals brain. Brain cells are destroyed with every passing second without blood flow. When EMS arrives, and again in the ED, be expected to be asked about time last known well. Time last known well is when the stroke victim was at their baseline without any stroke signs or symptoms. Verification is important because treatment options are dependent on a clearly established time last known well. You may witness a stroke at the very beginning, or you may witness stroke signs and symptoms sometime afterward. Either way, getting help is essential. Try to thoroughly communicate what you observed and recall when the stroke signs or symptoms were not present. Thank you for watching. For further information related to stroke, please visit American Stroke Association's website at stroke.org.